Hello everybody, welcome to our presentation today. If you are like most people, you probably have many questions regarding Medicare and the options available to you. We know that Medicare is not easy. Today, we intend on solving that problem. Many people feel confused or overwhelmed by the overabundance of literature, telephone calls, and advertisements via TV and radio on a daily basis. That's where we come in. I will be making Medicare very simple to understand. You will know the different parts of Medicare, your 3 options for coverage once you have parts A and B, and you will be on your way to making an informed decision upon completion of our seminar. Junkin & Company was founded by Jim Junkin over 20 years ago and focuses on placing its clients' interests first by delivering expert, unbiased insurance planning and asset preservation strategies. Best said by the late Paul Harvey, there is a significant rest of the story with respect to our company. We are affiliated with MSIS, Medicare Supplement Insurance Services, one of the largest independent Medicare brokerages in the country, if not the largest. MSIS was established in 1978 and has over 400 offices across the entire United States. We have repeatedly been the #1 agency for MSIS, ranked in the top 1% of Medicare advisors across the country. We are extremely proud to say that we have over 5,000 clients and have never had a complaint. And as Jim says, we don't intend on starting with you. Having Medicare explained correctly can make understanding Medicare very easy, and we can accomplish this in less than 20 minutes. Medicare is a dilemma for several reasons, including the following. As stated, it's a complex system. Most agents are inexperienced or underqualified and view you as nothing more than a fish in a barrel. You are being inundated with misleading information and guidance. Advertisements and commercials mention benefits that most people don't qualify for. They are simply using this as a tactic to get you to call. Your information may be sold to a sweatshop, or you can be switched to a different plan than was initially advertised. This all leads to wrong decision making, which can result in the inability to take all possible steps to save a life through proper treatment, a brutal tragedy. Wrong decisions can and do bankrupt people. A study published in the American Journal of Public Health in 2019 found that 66.5% of bankruptcies in the U.S. were due to medical issues like being unable to pay high bills or due to time lost from work. Unfortunately, wrong decisions might not be reversible. The bottom line is that individuals seek priceless peace of mind regarding their health care. We take pride in providing that every day. Some frequently asked questions often regard eligibility, the process of applying, terminology commonly used, the different parts of Medicare, your 3 distinct options, all the various companies you can choose from, and what you should do with all the marketing material. Medicare is the United States-based health care system. It covers people over the age of 65 and those under 65 with qualifying disabilities. Currently, there are more than 60 million Medicare beneficiaries. From 1946 to 1964, there were 72 million babies born, with 10,000 people each day turning 65. This leads to an overwhelming influx of new applicants. Do not delay in preparing for Medicare. Plan the same way you would for a family vacation in advance. Medicare enrollment is automatic if you are collecting Social Security benefits prior to your 65th birthday. If you are not collecting Social Security, you must call them to enroll in Medicare. If you or a spouse are actively employed by a company with more than 20 employees, you can delay enrollment into Medicare Part B. Remember, Part A is usually free, and Part B has a cost, which we will discuss. You can enroll in Medicare one of 3 ways. Some people find it easiest to enroll online at ssa.gov. Others choose to go to their local Social Security office. Or you can call Social Security to complete enrollment. Your initial enrollment period is a 7-month window surrounding your birth month. Let's talk about insurance terminology. To make things simple, Medicare shares terms with other forms of insurance. Some of the most important ones are premium, deductible, copay, and coinsurance. A premium is a fee, usually monthly, that you must pay in exchange for coverage. You must continue to pay your premium or you will lose this coverage. A deductible is your first dollar responsibility. You must pay this amount before insurance kicks in. Copays are set dollar values. If you visit a primary care physician, you might pay a copay of $10, for example, each visit. Coinsurance is usually a percentage. If you are liable for 20% coinsurance for a particular service and a bill is $100, you pay 20%, or $20 in this example. Most plans have a maximum out-of-pocket, meaning once you reach a certain dollar amount per calendar year, you no longer have financial liability for covered services. Medicare Part A is free so long as you paid into the Social Security system. An individual needs 40 quarters of work from you or a spouse. Usually, required taxes are automatically withheld by your employer. If you do not have the work history required, you must pay a premium for Part A if you enroll. For 2021, Part B has a monthly premium of $148.50. High earners will have an income-related monthly adjustment amount, IRMA. IRMA also affects the cost of your prescription drug plan, Part D. Upon turning 65, you can defer Medicare if you have creditable group coverage from an employer with more than 20 employees. If there are less than 20 employees, you must enroll in Medicare when first eligible. Upon retirement or a similar event, you can use a special enrollment period to enroll in Medicare. Part A, hospital insurance, covers inpatient hospital stays, care in a skilled nursing facility, hospice, and some home health care. Medicare Part B, medical insurance, covers certain doctors' services, outpatient care, medical supplies, and preventative services. You have 3 coverage options while enrolled in Medicare, the first being Original Medicare only, consisting of Part A and Part B, which cover approximately 80% of your medical costs. Without secondary coverage, you are liable for copays and coinsurance with absolutely no limit on what you may owe. This is an option, but in your mind, think of it as a dead end. The second option is adding a supplement to your Medicare coverage. Medicare supplements were created and are standardized by the government, meaning no company can offer anything fundamentally different. Supplements offer a drastic difference in liability from having Medicare by itself. By purchasing a Medicare supplement, you are electing to pay a nominal monthly premium to cover your 20% liability. The third option is a Medicare Advantage Plan, which functions as a pay-as-you-go system. Your insurance is administered by a private company. Advantage plans usually offer less freedom, may have a monthly premium, and most have higher financial liability than Medicare paired with a popular supplement. Remember, you have 3 potential coverage options while on Medicare. Number 1 is simply Original Medicare by itself. This option is problematic because it is leaving you open to a multitude of expenditures as well as potential penalties. Most professionals should highly advise against this. Unfortunately, that isn't always the case. Generally, you will get Part A for free, pay your Part B premium, and have roughly 80% coverage. You need a prescription drug plan still or creditable coverage elsewhere, such as the VA. This is a dead end because having deductibles, coinsurance, and 20% liability with no limit can result in astronomical bills. The second option is to fill the gap, hence the term Medigap, with a Medicare supplement. Medicare supplements are a form of secondary coverage offered by private insurance companies. They are standardized by the government, meaning nobody can offer anything fundamentally different. By law, the only difference is the company and the cost. Original Medicare, with or without a supplement, gives you the freedom to visit any doctor and any hospital as long as they accept Medicare. If they accept Medicare, they must also accept your supplement. With the most popular supplements, you are only liable for your Part B deductible. In 2021, that number is $203 per calendar year. Once that has been satisfied, you usually have zero liability for any services covered by Medicare. Medicare pays their portion, and the supplement pays the rest. If you hear things like Plan F, Plan G, or Plan N, know that it is a Medicare supplement. The third choice is a Medicare Advantage Plan, commonly referred to as Part C, MA, or MAPD. This is where a private company administers your insurance on behalf of Medicare. You still technically have Medicare, but providers now bill your Advantage Plan instead of Medicare themselves. If you hear HMO, PPO, or DSNP, you know that's a Medicare Advantage Plan and a network is involved. You cannot see any doctor or go to any hospital as they must be in your network if your plan has one. You will normally have a $0 premium, but liability is in the form of copays and coinsurance for every service rendered. These costs can add up to your maximum out-of-pocket for the year, which is capped by the government annually. In 2021, that limit is $7,550 for in-network and $11,300 for out-of-network services. Companies do have the option to have a lesser maximum out-of-pocket if they choose. Remember, this figure does not include drug costs at the pharmacy and resets each calendar year. Advantage plans usually include at least some coverage for dental, vision, hearing, and other ancillary benefits. So let's do a quick recap on what we've covered. You have 3 coverage options while enrolled in Medicare. First being Original Medicare, only with absolutely no limit on what you may owe. The second option is adding to Medicare with a Medicare supplement in order to limit your liability to the Part B deductible and still have freedom of choice. The third option is a Medicare Advantage Plan. Advantage plans usually offer less freedom, may have a monthly premium, and most have higher financial liability than Medicare with a popular supplement. This is very important. You can switch from a supplement to an Advantage plan easily, but usually you cannot switch from an Advantage plan back to a supplement unless you qualify medically. When on Original Medicare, with or without a supplement, you want to have prescription drug coverage. If you do not have creditable coverage through the VA, employer, or other source, you need a standalone drug plan. Most Advantage plans have their prescription drug coverage built in. If you see MAPD, know that means Medicare Advantage prescription drug. Advantage plans and standalone drug plans can change every year during the annual election period, or AEP. It is extremely important to shop your plan out for the following year. We assist every single client with this each fall to ensure their health care is in line for the following calendar year. By now, you have learned enough Medicare basics to have an idea of what kind of coverage you would like to have. Making the right decision can drastically affect your health and your pocketbook. For no cost, no obligation consultation, please call us at 440-834-4881. And if you have any questions or comments about today's presentation, please feel free to contact us. Thank you.